everyone, myself Prachi, a student of Marwadi University. So today I am going to discuss about the pathological basis of pain in peptic ulcer. Peptic ulcer is a localized defect in the gastric or duodenal mucosa. It occurs when mucosal defense mechanisms are overwhelmed by aggressive factors such as hydrochloric acid, pepsin, Helicobacter pylori infection, NSAIDs. Ulceration extends through the muscularis mucosa and exposes deeper tissues to acid and digestive enzymes. Pathological basis of pain. Pain in peptic ulcer is mainly due to acid-induced irritation of the ulcer base, inflammation around the ulcer, spasm of surrounding smooth muscles, increased sensitivity of exposed nerve endings. The ulcer crater exposes tissues beneath the mucosa. Gastric acid and pepsin directly irritate these tissues, producing the characteristic pain. Role of inflammation. Inflammatory changes are ulcer causes local tissue injury. Inflammatory cells infiltrate the ulcer base. Mediators such as histamine, prostaglandins, bradykinin, cytokines stimulate the pain receptors. The patient experiences a burning, gnawing or aching pain in the epigastric region. Pain mechanism in duodenal ulcer. Duodenal ulcer, acid secretion is usually increased. Pain commonly occurs 2-3 hours after the meals and commonly at night. Then pathological reason for the pain is after the stomach empties, acid enters the duodenum and comes into contact with the ulcer crater, irritating exposed nerve endings. Clinical feature. Pain is often relieved by food intake or antacids because they neutralize the gastric acid. Pain mechanism in gastric ulcer. Gastric ulcer pain typically occurs shortly after the meals. Food stimulates the acid secretion. Pathological reasons for the pain. The ulcerated gastric mucosa exposed to acid during digestion, producing pain. Clinical feature. Patient may avoid eating because food aggravates symptoms leading to the weight loss. Histopathological correlation. The chronic peptic ulcer shows 4 layers. First one is surface necrotic debris. Second one is inflammatory exudate. Third one is granulation tissue. And fourth is fibrous scar tissue. Relation to the pain. Inflammation and tissue destruction expose sensory nerve endings. Acid and pepsin penetrate the damaged tissue, and this leads to the persistent epigastric pain. Summary. Pathological basis of pain in peptic ulcer. Mucosal ulceration exposes deeper tissues. Acid and pepsin irritate the ulcer base. Inflammatory mediators stimulate the pain receptors. Muscle spasm around the ulcer contributes to the pain. Exposed nerve endings become highly sensitive. Thank you for watching.